Welcome again. Good afternoon, everyone, and thank you for joining. We're excited to have you attend our internship session overview, which is the first start to learning about the many projects that we have in our Maryland-based organizations. I'm Nick Sweeney, Wellness Director and founder of Amani Nicol Wellness and Elevate Empress. We have a panel of wonderful professionals supporting our mission, as well as supporting our community partnerships with your support bridge. So what we'd like to do to get started, we're going to introduce our panel because these are the ladies who will actually be responding to your requests concerning our projects. What we have lined up in this 1 hour session is an overview of who we are as an organization, the programs you have the ability to support, and of course, the next steps to become a candidate for these projects. Although all participants at this time are muted, we encourage you to use the chat. At the end of our discussion, we'll also make room, time permitting, for any questions that you may have about the projects. This session is being recorded and it will be available, the recap will be available at the conclusion of our session. So to get us started, to get us underway, I would like to introduce, we have April Robinson.
Good afternoon, everyone. It's wonderful to be here. Welcome. My name is April Robinson. I am currently on the board of directors at Elevate Empress, the nonprofit arm of Amani Nicol, and currently I'm serving as the vice president.
Thank you, April. Tasha.
Hello, everyone. I am Tasha Smith. I'm a lifestyle coach for diabetes prevention program and also director of development with board of directors of Elevate Empress. So happy to see everyone here.
Thank you, Tasha. Gwen?
Hello, my name is Gwen Winston, and I currently serve as the secretary of your support bridge. We are community partners with Amani Nicol and Elevate Empress.
Thank you, Gwen. Anitria.
Good afternoon, everyone. My name is Anitria Bullock. I am board president for your support bridge, and we are so excited to learn more about each one of you candidates today.
And thank you, Anitria. So let's get started. Our project span from supporting chronic illness management and support throughout Maryland, Baltimore City, Baltimore County, surrounding counties, including Prince George's, as well as Montgomery. So you have been invited today by Amani Nicol Wellness, which is a holistic wellness spa, changing the way that women take care of their health, especially when it comes to chronic illness prevention and management. Our motto is self-care meets healthcare. So just to give you a glimpse of why we're so excited about these projects that are making their way, that we recently relocated our spa to a larger ADA compliant space so that we are able to support even more in the community, which you'll learn even more about in just a few moments. To give you an idea of the client experience, how our ladies are supported, I'd love to share with you just a snippet of what the experience is like. Welcome. We make self-care easy. A 1 hour session is a great way to to recharge, relax, and reset. Trust us, she's about to enjoy her session. There we go. Self-care meets healthcare for our clients. And for those of you in the public health sector, you truly understand the mindset shift that has to take place in order to support behavior change. So our holistic approach takes into account the barriers that affect women and their ability to stay on a consistent path to better health. When we think of time, the lack of it, stress from the overload and overwhelm of women day-to-day activities, and if you haven't guessed it, our focus, of course, is women's health, although we have partners to support men because we know we'll get that question in the end. But when it comes to our women, we take a very targeted approach or intentional approach to helping her overcome stress overload, energy, and of course, the impact of chronic illness. So giving her access to a place where she can reset to feel well first. When she feels better, she'll do better, she'll even do more. So our interventions include not just a beautiful spa in sight, but it's coupled with evidence-based curriculum. We're all familiar with the National Diabetes Prevention Program. Our diabetes prevention program is uniquely titled Beautifully Well for so many reasons, as you can imagine. But this evidence-based program and CDC recognition has also given us the ability to support even more in the community with our Medicaid approval and contracts with 3 major medical insurers. So our community outreach, you'll hear that ring throughout the program descriptions, because what good is a program if no one knows about it? What good is a program if we don't take serious efforts to meet the needs, especially when it comes to cultural competency? We know these programs work, but why is there a shortage of referrals? Well, this is where you have the ability to support these efforts. They may be based in Maryland, but we are definitely setting the tone and the pattern for success for initiatives, not just nationwide, but on a global effort. Our programs include youth efforts, because how can we shift the paradigm if we don't first start with our young ones and changing the way that they view health? We're expanding access. As many of you who are on the call, you've already heard about some of our program expansion efforts. We'll go into a little more detail. And we're developing community partnerships like those with your support bridge in order to help us reach more and expand resources to the community that they need related to their health. So let's dive in. The first project is Project Inclusion. This project is actually coupled with efforts on behalf of the Maryland State Department of Health. This expanding access is to include opportunities for those in the Hispanic, Latinx communities to benefit from the virtual diabetes prevention program. So we are happy that we have a bilingual coach on board, and we're always looking for more. And our ASL, or American Sign Language coach, is already certified and ready to go so that we can build our program, not just for the sake of this contracted opportunity, but so that this program, as well as our Spanish delivered program, has longevity and not just a one-year pilot. So the project's support that we need will include research, researching how these two under-resourced communities are impacted by prediabetes and diabetes if we're not able to help them prevent it first. We're looking for support in terms of our marketing efforts. We call that the fun stuff, graphic creation, as well as developing a toolkit and infographic for the healthcare community so that they can see that it is equally important to support those with access to a program that will give them the ability to reverse the prediabetes or the high risk factors. Our second program involves the support that we need for the Beautifully Well in-person spa program. This program is also evidence-based with access to data to prove that when women carve out time for self-care, they are making time to make better, healthy choices. So what are we looking to do? First, there's our school outreach initiative. Title I schools specifically, as you all know, have a stronger population that are receiving Medicaid support. So this school outreach is an outreach that is not unfamiliar to Amani Nicol at all, because we've partnered with various schools for the past 10 years, but we need support to reach more and also develop a toolkit for school nurses in helping us to identify those moms who would be a good fit, those moms and caregivers. We're excited about our partnership with Aetna, United Healthcare, as well as MedStar. But we have been charged with the mission to educate physicians on what we would all think they're well aware of. However, there's a need to take the CDC's toolkit to the next level with a personalized approach to meet the needs of our community physicians so that they're able to use us as an extension of support for their patients. And secondly, we all know, we'll use this phrase throughout, and that is cultural competency. How can we meet our participants where they are if we don't know where they are? So one thing's for sure, we're not going to skip a hair appointment. We definitely won't skip a nail appointment. And if we are able to take advantage of a really nice massage here or there, well, then now we're on to something. So we're looking for support for our beauty and wellness outreach. So that sums up Beautifully Well. Next, we'll get April as well as Tosh, if you'd like. You can decide who can go first. Just to give a snippet on our nonprofit Elevate Empress. We're so excited about her and launching programs related to her. So if you are a student who are excited about youth programming, well, we could use the assistance. April or Tasha, I turn it over to you.
Tasha? I don't want to, talk over anybody. Yeah, so this is very, very exciting. We are passionate about our, young ladies. As Nick has mentioned, we're trying to really shift that generational paradigm. We want to start early. We want to get our young ladies really excited about making healthy choices. And we know that food choices really affects, our mood, how we feel about ourselves. And we want to really lay that foundation for a bright future for them. We're definitely working with our mothers, our aunts, our, caregivers, but the Elevate Empress really focuses on, our young ladies, and we're definitely passionate about it. We need that support. If you choose to, support Elevate Empress, we definitely promise that we'll need research. We want to develop your critical thinking skills, things that will definitely help you to be successful in your career later on.
Thank you, April. And I'll add to that, the Empress of Healthy program incorporates empowering our young girls to get excited about diabetes education. They'll become ambassadors of change equipped with this knowledge as they have fun along the way. Tasha, did we miss you? Or are we holding on till the end?
Oh, no, and I just was going to add, in connection with yours and April's, again, getting our young women excited about themselves. That piece is critical, definitely in these times where there's so many things going on. That's distractions. However, as April stated, starting young and learning that your health and wellness matters and taking that as the first step to go forward. And we know that it will have a great impact on the whole family because of just that one mindset change, and it will continue to flow through.
Awesome. Thank you for that, Tasha. So that sums up the Empress of Healthy program. I'll just chime in really quickly as we segue to one of our community partnerships, that Elevate Empress has an urban farmer initiative, which has already started an implementation process in Capitol Heights, Maryland, Prince George's County, with one of our program partners. And this urban farming initiative is an initiative that supports those food desert areas. And so as you can see, partnering with local organizations, community-based organizations, plays a huge role in us being able to expand the support and access that the community needs. And with that shift, I will turn our attention to one of our nonprofit partners, and that is Your Support Bridge, with a very exciting initiative to support our children and families of Baltimore. Anitria?
Thank you, Nick. Good afternoon again, everyone. Just wanted to share a little bit about who we are here at Your Support Bridge. We are a nonprofit organization that provides life care supports for those that contend with chronic and terminal illness. And we're really excited about this partnership with Amani Nicol, because we want to close the gap. So here at Your Support Bridge, we provide supports for seniors, men, and children. And so today we are looking to share with you that what our asthma initiative, Your Support Bridge, is looking for assistance with outreach so that we can find pediatric partners that can identify families that contend with acute chronic illness with asthma. And we want to educate these pediatricians as well as the families on triggers, how they can help minimize hospital visits, and how they can also minimize being on steroids for long periods of time. This is something that's dear to my heart and many of my friends. I have children and family members that are asthmatics, and simple things like the season change will cause some triggers. So we really want to help find pediatricians that can identify families that we can partner with and help educate them, to spread the word, to help minimize some of the synthetic things that we are putting or they are putting in their children's bodies, as well as adults. And so that's one of the efforts that we here at Your Support Bridge is looking for. We have needs with support from marketing, as well as our social media footprints. We have a few other project efforts that we are working to develop. And so partnering with Amani Nicol and seeing the wonderful efforts that they are pushing forward with, we want to bridge, pun intended, bridge this gap so that our community supports are not limited to any one area, but that we are reaching everyone that has a need and to fill that need. And so at this time, I just wanted to take a minute or so. Gwen Winston, did you have anything that you would like to add?
Just to say that we're excited about the opportunity to have the opportunity to partner with Amani Nicol and also to work with you, because we really value your assistance and we really value what you'll be able to bring to us to help us with our efforts. And so please take the time. The asthma initiative, as Anitria mentioned, is dear to our hearts, and it's something that we found from talking with community providers, family daycare providers, and other families, that there's a need for services and resources. So we thank you for coming on board, and we ask, you to, take the time to investigate, and hopefully we'll be able to work together soon.
All right, back to you, Nick.
Thank you, Anitria and Gwen. So exciting. We have Tasha, would you like to do a rundown of the title of the 4 initiatives before we open up Q&A?
Thank you, Nick. So just to recap, we have the NDPP expansion project, inclusive. We have the community outreach, Beautifully Well. We have the Empress of Healthy Youth Program, and of course the nonprofit partnership community health program. We are so very excited to have everyone that's here that's wanting to learn and also support all of these initiatives. Back to you, Nick.
Thank you, Tasha. So these 4 program topics, I'll keep this slide up for just a moment if you'd like to jot them down, take a note, or take a picture of it. These 4 projects, of course, as you know, this was simply an overview. The big skill set for every single project is a willingness to support, especially those in under-resourced areas. A passion for that, a passion for community. The second skill set would be using your skills, as Gwen mentioned it, and you hit it on the nose. We will benefit tremendously from your skill set, from what you bring to the table for us. So these projects are definitely, they go full circle for all of us. Keeping in mind that some of these projects, well, I won't say some of them, all of them are centered around community health. Every project has the ability to use data that can be used to assess how sustainable as well as practical, not to mention how are we actually supporting those who need it the most? Are they benefiting from our programs? Is the approach working? And you as a student willing to dedicate time between 6 to 12 weeks with these projects, just imagine adding in the ability to support these programs that are coming full circle, especially in light of managing our chronic illnesses. And so there's a variety of layers, from graphic support, social media support, research-based. We want you to take a moment to think about those things. We're keeping our process simple. We had quite a few register for the event, and I'm sure many will reach out for a recording, and we'll be sure to provide that. But what we would like for you to keep in mind first is the next step is sending this email. Some of you have already sent your email to us, and I will just say, wow, I am blown away. And you know who you are. We're already feeling quite a bit of synergy for the students that have reached out via email. We will, as a panel, review the emails that have been sent to us. For those of you on the call, email your resume to ndpp@amaninicol.com. Please include projects that you may specifically be interested in. You are not limited to supporting one project, because some projects can actually be worked depending on the time that you have to allot it for it. They can be worked in unison. What I would like to add before we open it up is these projects, some are ongoing. For example, the project inclusion, we are at the heart of the start of the project inclusion, which, just to recap, is expanding access to the Hispanic and Latinx community. This project is ongoing, and we're looking for support that can assist us early November into mid-December, and the support will actually continue on throughout January. I know that the asthma study with your support bridge will be looking for interns to start supporting them during January, during that semester. So we would like for you, if you have an interest specifically in either one of the projects or all of the projects, make a note of it inside of your in your email. These projects at this time are unpaid internship opportunities that we know will bring an amazing experience to your public health resume. When funding allows, if funding presents itself, and we hope that it will, especially with project inclusion and outreach, and we're working hard to secure these opportunities and looking for other opportunities as well, which means that a project or two may have a stipend compensation tied to it. At this time, we're unable to promise or guarantee a stipend or paid internship. However, we look forward to not only being able to work with you future-oriented, but keep in mind that because these projects are going to go beyond our project timeline, that these are sustainable projects needed in the community, that there may also be opportunities for you to support us in the future on a contracted or hired basis. So please, we ask that you keep that in mind. Before opening up to Q&A, we always ask that you forward this information, tell other interns or even professors about this opportunity to support us. We know that we are looking for about